Hi, this is Gerald Orlees. I'm with Dr. Meir Tako here in Sunnyvale. And Meir, thanks for sitting down and taking the time to just talk with me. I appreciate you being here.
It's my pleasure.
How long have we known each other? Maybe since, what, 2010?
Probably, yeah. 2010, I moved to this area.
So tell me a little bit about your story. Like, what inspired you to become a chiropractor? What, got you into the profession?
So, I studied biochemistry, and I had the beginning of a biochemistry career, and my body was shutting down because of previous injuries and history of from sport injury, military service, all kind of different things. So I was really not in good shape. And the usual things, the medical doctor, the physical therapy didn't really work for me. Until, believe it or not, one of the doctors suggested, "Hey, did you try chiropractic?" And I'm like, "Okay, we're going to try chiropractic." And sure enough, that started to make all the difference in the world. And I really fell in love with the concept. And I made a change.
Nice.
I came to the United States, went to Palmer, became a chiropractor, and started practicing.
So as a chiropractor, you probably learned a number of different techniques. I don't know, what are some of them?
In the beginning of my career, I was mainly doing Gunstead, which I still use, in network spinal analysis, SOT, flexion distraction, activator. So a lot of different techniques, but the main techniques that I'm adjusting with is the Gunstead approach.
Now, with those techniques, you obviously became a very good chiropractor, very good adjuster, and saw a lot of healing results from that alone. But did you at any point feel that you were possibly missing something clinically that you can add on top of what you learned from school and in some of the chiropractic seminars after school?
Yeah, so as I start to see patients and progress in my practice and gain a lot of experience, I noticed that there are people who are not getting better no matter what I'm going to do, and I'm really delivering really good adjustments, and it's just not cutting it. And that made me kind of wonder what's going on. And they teach you when you study the chiropractic model and you learn about subluxation, they tell you it's a physical, it's chemical, and it's also emotional. So I said, well, maybe we are not addressing something here. We are really just adjusting. This is just addressing the structural part of it, but we're really not solving anything. So you see a patient that has always low back pain, you adjust them, and it's just not really doing anything. And it's like it makes you wonder why somebody who looks normal on x-rays, you're doing really good adjustments, they're following your instruction, they're doing their stretches and exercises and everything, and they're still having some problems. And from time to time, I would see cases that are really, really complex, and it's like the adjustment is just not good enough. It's missing something. So it's fixing a lot of issues, but then there is a lot of other patients, a large group of patients, that if I'm being honest with myself, they're not getting better. Yeah. And since I'm very result oriented, it started to really, really bother me. So I started to kind of ask questions and start to look around, and simultaneously, I had a personal injury with my shoulder that prevented me from getting back to Gunstead adjustments and full practice, and I was kind of wondering what to do. And I came across a wonderful work that was developed by a spinal surgeon that became a career diplomat and also applied kinesiologist. And he developed his own approach, and it's called PDTR. And PDTR teaches you really principle that I now think that they're the right approach. And it talks about signals and how the nervous system is communicating and how this function is created. And I start to realize that maybe the subluxations that we are so hold dearly and adjusting are maybe compensations to other things. And sometimes the compensation is in the internal organ, and now we have a problem there. So it's something that starts as an ankle sprain ends up to be also a digestion problem or constipation, and nobody puts it together. And then I start to learn how to address that, and this is where I start to really utilize some of my knowledge in biochemistry, but also a lot of the information that I'm learning with standard process, how to address liver dysfunction, intestinal dysfunction, and by normalizing that part of the system, suddenly the muscles are they're firing normally, and suddenly the subluxation is gone, and there's no pain, everything is moving properly, everything is working. And that gave me really the answer and gave me a completion of how to work with patients. The chiropractic way is to really adjust and address subluxation, which is interference in the nervous system. But instead of just minimizing it into, it's a nerve, spinal junction, it's a lot more. It's encompassing the entire nervous system. And if we do that, we start to look at signals, then you have to address the internal organs. And the better you become at addressing those issues, the more complex cases you can actually help and really turn people's lives around.
So prior to you finding PDTR, you were practicing chiropractic from a very somatic, if there's a subluxation, go and conduct a spinal adjustment or spinal manipulation.
No, an adjustment.
Okay, an adjustment. And knowing though, from having learned in school that wherever there's a subluxation, there's also a muscle reflex that connects that subluxation to an organ or the visceral aspect of the body. And mostly you were just going after it from a somatic approach, where in fact some of the patients were not necessarily seeing their health issues resolved because perhaps there was either support needing to be provided on the visceral side, or just certain things or patterns needed to be cleared so that the communication between the visceral and somatic could open up, where in many cases the muscle reflex would enable now certain muscles to relax. Thus then you would see visually, without having performed a spinal manipulation and adjustment whatsoever, but just by reestablishing the communication, you would then see the subluxation disappear.
Absolutely. In a permanent way.
You mentioned that sometimes you find that if the visceral aspect needs to be strengthened, there's nothing else that can strengthen it other than nutrition. Assuming that the somatic aspect has been addressed, the communication has been restored, but the visceral aspect still needs some strengthening. What have you found to be effective for that? And maybe you can talk a little bit about your path to incorporating the standard processed food formulas, what your learning was like.
So, when it comes to nutrition and supplements, there is a variety of different things in the market, many different companies. But what I really like about standard process is the philosophy that we really need to eat. That kind of makes sense to me. Using supplements that are much more fractionated and just isolation of molecules, that's kind of more medicine than not. Is there a place for it? Yes. And sometimes I use it too. Clinically, when it's required, I'll use an isolated molecule. But in the end of the day, we need to feed the body. When you give the body food, the body knows what to do with it. It's congruent with chiropractic philosophy to me. It's like you supply the body with what the body knows how to utilize, and it does it very effectively. And then you don't need much. And I found in standard process a very reliable system that gives me consistent clinical outcomes that I can rely on.
Back in, was it 2013, you went to the farm in Wisconsin?
Yeah.
Yeah, what was your trip like? What did you see there when you were there?
Oh, that was incredible. I grew up on a farm.
Did you really?
Back in Israel.
Okay.
So I know how farms looks like usually and how farming is going. And I was extremely impressed. I was really, really impressed with the way they're maintaining the farm and the way everything is managed in the farm. It was really inspirational to actually see the farm. I don't think I ever seen anything like this. And I grew up on farms, and I know farms. So I thought.
Right. And you had a Spanish black radish experience when you were there?
Yeah. So one of the things that I knew the product Spanish black radish, but I never ate one. And it was right in the season when they're growing the Spanish black radish, which is an incredible product, and for what it does and what it costs, it's amazing. Really helps with detoxification and drainage in the body and methylation, and really awesome product for the liver. But I had the opportunity to pull one of those out, and like the way I grew up on a farm, it's like cleaning up on my shirt and took a bite. And felt the texture of it and the taste, the flavor of it. And it's very flavorable. It has a lot of flavor.
Yeah. Very phytonutrient dense, so that the patients who take it can see consistent clinical results. And get the actual nutrients that their body's been missing for all these years. Because I mean, what percentage of your patients would you say eat raw radishes on a regular basis to support their liver?
Not a lot.
Yeah, not a lot.
And most of the time, when people eat vegetables, the soil is depleted. It's not growing on a true organic farm where you take care of the soil, not the plants.
Right.
Most plants, most vegetables today grows when they take care of the plant. They put in the soil some nitrogen or some or phosphorus or potassium.
Yeah.
That's basically, and that's it. In a true organic farm, you're really taking care of the soil and you're cultivating the soil. So there is really rich of nutrients and phytonutrients and trace minerals, which is really one of the problems that we're facing is the trace minerals are gone. All the copper and zinc and selenium and a lot of different things like that. That brings me back into biochemistry. Okay, all those little ingredients that the cell needs. Later on, as I was learning more, I started to learn how to use herbs. And the Meir's line is just extraordinary in its effects and accuracy. I like the fact that it's standardized and we know exactly what's there, what kind of active ingredients. Unlike a lot of the supplements out there, I usually like to give the echinacea as an example because there are 7 species of echinacea, but only 2 of them will have the active ingredient, the alkylamide. And yet you see companies using echinacea, but there is no active ingredients or very minimum. So people don't get the results from a plant that is extraordinary.
Yes. Yeah, and in a previous career, I mean, you were a biochemistry major, right? So, I mean, do you find that knowledge is applicable in what you're learning with herbology?
So when you have a background in biochemistry, it gives you just basic fundamental knowledge of some of the pathways, some of the major pathways, and you can. But again, it's just a tool. So if there is a subject you want to learn, you can go back and learn it. It's easy. I don't remember all the details, but it helps to know that you produces energy with mitochondria. It helps to know that certain deficiencies will create unhealthy mitochondria. It's helpful. Yeah. It's helpful to know that mitochondria works with B vitamins, but also magnesium. It helps, right? So when you start to talk to patients and you see that they're tired and when they're tired, what time of the day, and the patterns, you start to learn how to identify patterns and how they relate to different organs, whether it's the thyroid or adrenals or just mitochondria dysfunction. And you start to understand actually there are different things that can cause problems in these organs. It might be toxicity, but it might be deficiency. And that's why the organs don't work. But combining all of it together in a kind of a mash, you can actually start to really make a difference and relatively quick.
Now, to understand this mesh, all this knowledge from understanding deficiencies and possible environmental toxicity that's impacting or preventing healing in the body, how did you go about getting that information? Where did you learn about that?
So there are fundamentally 2 things that I do in my office. I use labs. Okay, and in many cases, labs are very important.
So you do blood, saliva.
I do blood, saliva, urine analysis, genetic testings. But I can't say that I use it primarily because I have a very powerful tool that I'm utilizing, and it's muscle testing. And the interesting thing about muscle testing, if we don't understand, and there used to be time that I didn't understand it and I thought that it's really strange and weird. But now I understand how muscle testing works, and when I do, I utilize muscle testing, and what I'm realizing is that with muscle testing you can pick up on a lot of things that then blood work will never will. Or you need to do thousands of dollars worth of blood work or lab analysis before you're gonna even catch anything. And even so, let's take something like deficiency. So you can do a very expensive lab from SpectraCell or Genova, for instance, and you're going to spend $1,200, and it's going to give you a whole list of all the vitamins and minerals and amino acids that you're missing. And I don't have to do a $1,200 test for that. I can do muscle testing that tells me very specifically what needs to be done. Muscle testing is an art. You need to know what you need to know in order to perform it properly. It has to be done in a certain way, and when it's done in a certain way, you get consistent results.
You started muscle testing with the PDTR and then picked up the nutrition response testing, and we had a nice good group of people going through the nutrition response testing. And I remember you had this one patient who came in and you were using the kits and you found that this one patient had a copper toxicity, and you asked her about, do you have any copper in you? Do you have any source of copper? And she mentioned she had a copper IUD in her. And at that moment, her daughter brought to the mom's attention that every time she wore jewelry, she would get a rash, thus indicating that perhaps this copper was no longer localized where the IUD was placed, but it was systemic, and it became now almost an autoimmune issue. And that was a huge discovery of using a system, the way it was designed, to gather exactly what information on an assessment, but also furthermore finding an exact program, nutrition program for that case.
Right. So in that case, this particular patient was 40 years old, and her FSH was skyrocketing, and usually it's an indication of menopause. And she was 40, and she said, no way, 40, I'm going to go into menopause. I still want to get pregnant. I want to have another baby. And the doctor said to her, no, you can't, because you're already in menopause. It's like your pituitary is responding that way, and your ovaries are shut down. So when she came in, we found relatively quick that day. We found what's the cause. We found copper toxicity, and we were able within 1 month normalizing her FSH level to normal levels. She was pretty happy with that.
Yeah.
So without the muscle testing, I doubted that I would find what it is that quick. And because we found it that quick, we were able to make a change. Because if I would go into, do all the lab work, it will take time and it will take a lot of money. Yeah. And so typically my go-to is muscle testing, and as the case unravels, we may want to do some testing.
And then from nutrition response testing, then we were introduced to the morphogenic field technique, help you uncover more or continue the investigative process, finding what's going on with your patients. From your career, from being just a structural chiropractor, then getting into improving the communication within the nervous system, between the somatic and the visceral with the PDTR, to improving, providing excellent nutritional tools. How important would you say it is for any practitioner out there who wants to incorporate functional nutrition into their practice? How important is it for them to attend seminars to get that information that you've attended with standard process?
I think the seminars are crucial. In the first 3 years, I didn't miss any. I just went to all the seminars. Every seminar, I learned something and I came back and implemented it. I didn't just sit on my hand on the booklet and on the notes and didn't do anything. I just really, every seminar I learned something, a principle or information, and I started to implement. And that just accelerated my practice really rapidly. Today my practice is really based on referrals. I don't have to do any marketing. It's just patients refers their family, their friends because of results. And I never experienced that kind of practice before.
It's the reason why I sent my family to you, because there's very few practitioners that I've had the opportunity to see such amazing healing results that I've seen happen in your presence, within what you're doing and the tools. And it also takes a special person to make that investment, to go and learn these tools.
Yes.
And then to persevere, and then to continue asking more questions. And the one thing that I've learned from you is you learn the most from the case you couldn't help, because it's what gave you the stimulus to go find what else you're missing to help this person.
And I think that's how we should be. We shouldn't focus on all the cases that we helped, because obviously we know what to do. It's the patient that presents with things that we don't know, and they're difficult, and we truly want to help. Then we start to investigate and we start to ask questions. And hopefully some of those questions are the right questions, so we're going to get to the right answers.
Now, we worked together closely for the past 5 years. For any new practitioner that's new to incorporating functional nutrition into their practice, how have I been able to best serve you? Like, what kind of resource can they expect when they work with me?
So that was really crucial, because it's important to have somebody that is responsive and giving you reliable answers that you can trust and you can implement immediately, and you show up for your patients with that information. So I have nothing other than saying thank you to you, because you've been there on basically daily basis when I needed you in the beginning, and now less and less and less, and maybe now I'm a resource for you, and as we start to teach each other. But in the beginning, it was very crucial, and I got all the help. Standard process was just extraordinary with the support.
And I have to say thank you to you, because as I've worked with you over the years, I've learned how I can be a better resource to other practitioners based on the questions you've come to me. And when someone can present to me a scenario or a question that I've never heard before, I get excited. And I had a lot of those moments with you because we did learn together, and I learned a lot from you, from not only, making sure that you are as, as solid of a clinician as possible, but even from a practice growth standpoint, from, helping train your staff or hiring, your front office.
Even hiring.
That was fun. That was a learning experience for me. And now I've developed this hiring procedure process that I share with other practices who are looking to have a front office person. And it started with your office, going through it. And of course, since then, that process has improved. However, we were fortunate enough that we found, you found somebody who was solid and has stayed with you for a certain number of years. And, and that process is something that we can help other practitioners
She's
with.
here.
Still here. She's still here. Great. That's awesome. 5 years later, employee retention is such an important thing for being successful. And how important would you say is it to work with someone on a business level? Obviously clinically you're great, but also if you're going to want to expand and grow to help more people.
It's very important because I'm sure every chiropractor who would see me talk knows that. There are so many pitfalls in running a business, running a chiropractic office, and will actually function properly.
Great, thank you for taking the time out to share with me and our viewers a little bit about who you are, what you offer to your patients, and your experience with evolving as a chiropractor and learning to develop and incorporate functional nutrition into your practice so that your patients can live healthy and happy lives that's drug-free. I think that's kind of your mission. Do you have an actual mission statement?
But, healthy and unmedicated. I think that's my mission for any of my patients. Every time they go off medication, we celebrate that, and that happens very often here. That people don't need their thyroid medication anymore, which is almost unheard of. So.
And for anybody who's watching, make sure that it's the prescribing physician who's adjusting the dosage. It's not you doing it on your own. You're not coming, the Dr. Tako is not doing that for you, but you always go back to the prescribing physician for that.
All we do here is helping the body to heal, and then there is no need for medication, and they have to go back to their doctors because they're now hyper. To go off the medication, and they do it with with medical supervision. They go off medication. You have to do it with medical supervision because medication can have side effect of withdrawal syndromes and other things. So you don't want to have your patient just getting off medication on their own. It has to be supervised.
Well, I appreciate you taking the time. It's been a pleasure. I love working with amazing people like you. Obviously, you're not only an amazing practitioner, but I consider you a great friend. And keep up the great work and do some more of this.
Thank you.